Connections Academy brings school to life. Visit connectionsacademy.com.
We are focusing on your good health today on Ask the Expert. Dr. Ryan Szepiela is here with the answers to some of your questions. Good afternoon to you, Doc.
Good afternoon.
All right, here's the first question. Not had much energy recently and cannot get going in the mornings. This could have come from me. I had a physical and all of my blood tests and results came back normal. What is wrong with me?
So, I mean, it's good that your physical came back normal. Low energy can have so many different causes. Laboratory testing can show thyroid issues with fatigue, blood levels, things along those lines. And sometimes you're just not a morning person. But when changes happens and it comes to issues with energy and normal lab testing, we always look into the possibility of depression. Depression is something that can have several ways to present itself, and fatigue and not being interested in the things that you like to do normally are good ways to identify that. It's very common for people to have in everyday lives. I know there's a lot out there about, oh, everybody's depressed to some degree, but treatments a lot of times are necessary and can help you overall. Just seeing your healthcare provider and getting screening testing in office and making sure everything is okay is an appropriate treatment for this, and then they can help you get further treatment if needed.
All right, yeah, check into those underlying possible issues. All right, thanks very much. And here's another one. I've golfed great recently. This is not for me with the nice weather, but I am having a lot of pain that won't go away in my elbow. Should I stop golfing, and how do I fix this?
That's not for me either, but most likely in this case you've developed medial epicondylitis. A lot of terms are thrown back and forth. Golfer's elbow, tennis elbow. In general, golfer's elbow tends to be on the inside of the elbow where you're doing with your backswing in that case, and it's caused by repetitive activity. And what it is where the bone and tendon meet. So when this gets irritated and inflamed, it's actually really hard to calm down. You can try taking a little bit of time off or watching how you swing your clubs and how hard you swing your clubs. Other things that can be done is stretching around this area using ice, and there's also a tennis elbow brace or a golfer's elbow brace that goes around this area like a little cuff that can help with that. Sometimes if this doesn't go away, I see people in my office and your healthcare provider can see you and they can do an injection in this area or further imaging if needed, or the possibility of doing appropriate physical therapy.
Oh, all right. Here's another one. What's the best way to treat a sunburn?
So the best way actually to treat your sunburn is to prevent it, but since we already got to this question, we're already past that point. So what you actually want to do is minimize the symptoms. You can use a moisturizer that has aloe vera or soy in it to help soothe the sunburn. Also, make sure you keep yourself hydrated. During this time, your body is going to require some extra fluids. Water is still always going to be the best, but just make sure that you're hydrating something other than alcohol. You can take cool baths or showers to help the pain, or take aspirin or ibuprofen to help with the inflammation. And definitely, especially during this period, make sure that you protect yourself from the sun.
All right, Dr. Szepiela, thank you very much for joining us this afternoon on Ask the Expert. Tomorrow on Ask the Expert, we're taking your legal questions. You can email them in advance at news@13abc.com.
Well, she's been missing for almost a year, but